Hi, Dr. Saxena here, and been talking on some different stuff. Was something called energy medicine we have been talking about. So, what is this thing called bioenergy therapeutics? And as you all know, there are the energy fields which are affecting all our interventions, and how what can you do about that? And I've been talking about energy fields emanating from your cell phone, energy fields getting from your lights, energy field coming from your microwave and all that. Apart from that, there are energy fields emanating from your each cell also. So over the past few decades, what happened was there are major institutions, biologists of working with biologists and physicists they around the world have documented what we have always known all along, that the human body is a conductor of energy, and and has a detectable energy field. In fact, the electromagnetic field of the heart is detectable 12 to 15 feet away from the body. That is the kind of thing we call it as aura in this side, but yes, you can always gauge that particular stuff. Someone entering that 12 to 15 feet distance, the electromagnetic field of the heart it goes up to that level. In the state of disease, what happens is the energy flows differently than in the state of health. See, there is a erratic. I was talking about photobiomodulation. I'm talking about something like energy fields. You have got symmetric energy fields, and if they are erratic, there is no dispersal of that particular thing. You have got your aura, or it's limited. So what happens is, in a disease state, energy flows differently than in the normal state. So the cellular level, a change in energy flow is the detectable sign of a disease. So just by understanding what we try to do with the autonomic ART and all that, trying to work with the muscle test, and the moment we just check that, we know there is something. It is a very hard of communication. It's a so the field affects everything, diagnosis and the medical management. What I do, it is a heart. The field is the heart of the communication system, which carries all the messages throughout the body. When the system is blocked, health is compromised, and so are our interventions also. Whatever I'm able to work it out, it doesn't help in that way. It is connected with the communication between the organs is intact. When it is connected, the communication between the organs, I never understood what is the communication of the liver with the heart. So now we try to understand there are some things. So you have got spleen, you have got large intestine. So all this kind of, there are in Chinese medicine they talk about meridians. So we